Good morning. As always, nice to have you join us on 3+U today. Can't believe we're nearing the end of August. Before we know it, September is going to be here. And as I'm sure you're well aware, every month of the calendar seems to have kind of its own special designation. The one for the month of September really will end up, I think, being very uplifting, but it sounds a bit concerning when you first think about it. It's Suicide Awareness and Prevention Month. And for anybody out there raising young people today, probably the talk of suicide is a more constant in your home than you might think, because kids are aware of it more and more now. If you're a first responder, chances are you've encountered this conversation before as well. Charles Miller is our first guest on the show today because he has really a different perspective on this, helping people at Scenic City Neurotherapy overcome some depression issues and things that can go hand in hand with these suicidal thoughts. So good to see you.
It's good to be here. Yeah, we at Scenic City Neurotherapy, we work with patients with a history of suicidal ideation, many different mental health issues that they've struggled with over the years. And our goal is, especially in the month of September, is to kind of bring back to the forefront that we are losing people unnecessarily to suicide. They don't know that they have resources available. It feels like their options are limited, and that's not necessarily the reality. And that's what we are trying to bring awareness to in the month of September.
Okay, so one thing that you had mentioned to me was that you wanted to make sure people remembered today, after watching you, that if you are struggling and you're in one of these moments, to call 988, not 911.
Yes, 988 is a mental health crisis number that has recently been promoted. People have seen it out there, but we're doing what we can in our community to raise awareness about this new resource, and let people know that there's trained people, trained counselors, mental health resources that are available to them. So if they're in crisis and they don't have the answer, there's a place they can go and get help.
So I know we want to get to what you do at Scenic City Neurotherapy, but bear with me 1 second on the 988, because sometimes the person who's walking the walk, right, they might not always see how frightening their thoughts are. If you are a family member, a parent, a spouse, maybe you're seeing it differently, but you don't necessarily have the right tools to know how to talk to that person.
Right.
Can you encourage them earlier on to call 988 and get some help?
Absolutely. It's not just for people who are in an immediate crisis.
Okay.
It's also for people who are just looking for better resources for their mental health.
Okay.
It's and also, we have an army of people we've collaborated with at Scenic City Neurotherapy that we can direct people to. We can give people options. We're not just for treatment. If somebody's looking for a resource, they can give us a call.
Yeah, I was going to take you there actually, so I'm glad you jumped in and did it first, because you use this word resources.
Yeah.
You really have a lot of partnerships and networking with people, because this is passionate for you.
Absolutely.
I mean, you want to find the fix for people, and you believe that you are one part of the solution, but you don't claim to be the whole solution.
Well, one of the things that we have, I guess, the stigma surrounding mental health makes people feel like it's some sort of emotional frailty or some sort of psychological weakness, but it's absolutely, that's not the case. It's a very physiologic in nature. Depression, anxiety, PTSD, bipolar disorder, they have a strong physiologic component in the brain, and so what our treatments are designed to do is optimize neuronal connectivity and communication. That's what neurotherapy is we enhance the way the brain functions. Now that works with many different disorders, but also with many different mood disorders as well. It's not just for chronic pain or with neurologic issues.
Right.
It's the actual way we think is physiologic in nature.
Okay, so I always feel like I'm going to medical school when I'm talking to you, because I'll learn a lot about how the brain works. But so let's go back to this idea of conversation that you have with somebody who's struggling with mental health, if you're an untrained person. And your tendency, if they are having a difficult day, is to want to fix it. So you might say, oh, it'll all be okay.
Right.
That simple statement to somebody in a bad spot can sound dismissive sometimes, right?
It's and in a way it is. It's there's no way we can know that, and that's not something. But the thing is like you're not alone. That's something we can say.
Okay.
We can say that that this is real. You can, let them know that you do see that even though you don't feel their struggle, that their struggle is valid and you acknowledge it.
So to the physiological side of things, if over years, months, what have you, you're hearing intended to be helpful comments that are actually hurting you more, it'll be okay, just go for a run, whatever. Does your brain compensate by having to work even harder now to get past the already difficulty that's there, and it causes more problem?
I think it directly contributes to the stigma. People feel that something's wrong with them because why can't I just do these things that everybody tells me to do?
Right.
Why can't I just try to feel better? And if this was something they could think their way out of, they would have by now. This is not it's like trying to run a marathon with a broken leg. It's an unfair ask.
But it's okay. So where you step in at Scenic City Neurotherapy is that you work hand in hand, you want to work hand in hand with a mental health provider. But what you do with these ketamine infusions and other types of treatment that you have is you sort of, is this fair to say, kind of open the brain up to better receive the counseling that comes people's way?
In some ways, but what it actually, what it's doing on a physiologic level is actually creating new neuronal connections. We're actually regrowing brain cells through a process called dendritic arborization. Now that's a huge word, but dendrites are the little arms that stick out from the brain cells that connect each other. Arborization, just like Arbor Day, like branching, new branches of dendrites and new connections to where the brain communicates in a more effective way, because the breakdown of these dendrites is directly associated with feelings of depression and anxiety.
So is that something that is better targeted when you're young, or if you're an older person, can you still benefit from it?
Oh, absolutely. We use this treatment for just the brain optimization that goes along with, say, treating idiopathic dementia, Alzheimer's. We use it for stroke recovery, traumatic brain injuries. Even what we see with this post-acute coronavirus syndrome, the brain fog that comes with, after a significant infection, we've seen.
Okay, so I'm taking you someplace that you would not have gone, but if I heard you correctly, this can help then as a prevention, or at least a slowing down of dementia, right? Of memory loss?
Absolutely. And what it is it's brain optimization. That's what I try to remind everybody. I said, don't think about what we do as just in the mental health arena or just in the physical health arena or pain arena. This is brain optimization. When the brain's functioning optimally, it impacts many aspects of our life. How we feel things, how we process stimuli coming in, how we feel in our bodies, how our brain communicates with our body, and certain types of pain dysregulation.
Okay, so to the Suicide Prevention Month in September, sometimes a diagnosis of something can be very frightening. People don't want to walk that walk. So if I hate to make this too blatant, but if you have an Alzheimer's diagnosis, maybe this is something that could also help a person's
It's about optimization. We can get what we have and get it working as good as it can.
Right.
It may not be perfect, and sometimes we're just slowing the progression. The thing about dementia or cognitive loss with age, it's a fight we will all lose eventually. If we live long enough. It's just keeping us the best version of us over the lifespan.
So I mentioned something about first responders. You have in the past brought one or two first responders with you who have found great benefit by coming to see you. So you're teaming up in the month of September, your practice is, with some other businesses in town, right, to kind of raise awareness of this. One of them is veteran-owned.
Renew Exteriors is a veteran-owned company that we recently did a promotion with, 4988. Also with Outshine Adventures. We have worked with them on a couple of different things, and we share a lot of similar values, and we genuinely care about our community. So it's, the three of us got together and did a promotion to just increase awareness for 988 and help people realize this is out there.
Okay, so if somebody's watching today and they or someone they know closely is struggling with a mental health concern, do they need to first go through their therapist to see you, or can they make an appointment with you directly?
If they don't go through their therapist to see me, then we will pair them with a therapist, assuming they don't have one. The important piece of this is that we are not the only fix. We deal with the physiology. And then if somebody comes to us, say just, cold calls us off the street, we'll make sure they have the resources they need to move forward. It's not just about going through our process. It's about going through our process, having the appropriate follow-up with trained mental health professionals. And we have, like I said, we have an army of people in the Chattanooga area now that we work with, and we've been amazed at at what we've been able to do with this teamwork.
Yeah, it's definitely grown quickly. I know you and your wife kind of came into it believing in the power of this and wanting very much to educate people. That was your primary focus in the beginning, besides just helping people to educate.
Yeah, absolutely. It's education removes fear or misconception. There's so much misinformation out there, unfortunately, with these types of therapies. And so we have to kind of weed through all the noise to pull out and show people what is actually true.
Okay, so for those of you who did not know, if you're struggling with anything concerning, if you call 988, you'll get a mental health professional on the other end of the phone. It's like a crisis line. If you live with someone, love someone who is struggling, don't say it'll all be okay. Say instead what you feel is real.
It's validate those feelings.
Okay, and then the number to call for Scenic City Neurotherapy is 228-0579. Their website online there as well for you to write down. And if you call them and tell them what you're dealing with, they'll guide you in the right direction. Great talking to you, Charles.
Thanks so much for having me.
Relax and get away with the new hot tub or swim spa from Aqua Living. Hot tubs starting at only $24.99. Check out the revolutionary Tough Top cover with a lifetime warranty. Swim spas that heat or chill the water. Bad credit, no problem. For more information, go to shophottubs.com.